Good evening, everyone. We'll kick off if that's okay. Apologies for the short delay there. You're very welcome here this evening to the august environs of Wood Quay for our final 2016 Decoding Cancer event. Just a little bit about that. The Decoding Cancer is a kind of a communications initiative that we do in the research department of the Irish Cancer Society to bring experts in particular areas into contact with the public and help explain the complexities around particular topics in areas of cancer research and cancer more generally. It's a patient-focused factual information exchange. We are live streaming, by the way, so this will be going out on the Irish Cancer Society Facebook page. And if you're interested in our Decoding Cancer series, which will be continuing into 2017, you can check it out on Facebook, you can follow on Twitter, and also research events at irishcancer.ie, or if you just get in contact with the Cancer Society through any of our vehicles, you'll be able to follow what's going on. Firstly, before we actually go into the talk, and Peter himself, want to thank our sponsor. This is the second talk that we've had sponsored from the European Cancer Leagues, and the ECL is a pan-umbrella organisation of national and regional cancer leagues. Their role is to facilitate collaboration between European cancer leagues in each of the different European countries and to help influence European anti-cancer policies and cancer prevention policies to improve cancer care and cancer control through collaboration in our European fight and our global fight indeed against cancer. So funding has come directly from their strategic grant agreement, which is part funded by the European Commission. And it's intended to assist qualifying leagues like the Irish Cancer Society, and we're members, to promote the European Code Against Cancer. Some of the details you'll see on pamphlets. It's basically an easy guide for reducing your risk of developing cancer. It's got 12 simple recommendations approved by the European Commission, and it's, I guess, an important initiative to help people understand how they can improve and reduce their risks of cancer. So now to the topic and the speaker, and we're kind of doing two things in one go here this evening. I think most people will be aware that alcohol is not good for you. I think we know that, and we've picked that up. We see the impacts in our society in that. But alcohol is simultaneously a simple and a complex topic to talk about. It plays a significant role in our society, culturally and in many other ways. It can be a social lubricant, and historically alcohol was quite important actually in providing a relatively disease-free liquid to keep us sustained, particularly when travelling. But there's now an increased and growing recognition of the social and health implications of alcohol and alcohol abuse, and our challenging cultural relationship with alcohol. And I suppose we have to be aware of the context, accepting that alcohol is harmful for our health, and our talk takes place against the backdrop in this country at the minute of a recognition of a growing need for regulation and integrated approaches into that regulation. There's no one overnight solution that will actually sort out challenges like alcohol, and there's a number of different moderation and reduction strategies that need to be implemented together. So we look forward at the Irish Cancer Society and many other health charities to the Public Health Alcohol Bill. Alcohol in Ireland is a significant contributor to several types of common cancer, and conservative estimates, and one of the researchers, Dr. Lavoie, here published research on this a couple of years ago, indicating that around 900 people will be diagnosed with cancer arising specifically out of alcohol, and 500 people will die each year in Ireland. Those are fairly big numbers, and it gives an indication as to why the Cancer Society sees the significance and relevance of this. In a very timely way, it also, this talk ties in with our annual Charles Cully Award. My colleague, our CEO, John McCormack, will talk about this after Peter has spoken. But it's an annual event that we have recognising leadership in the field of cancer control, cancer prevention, or health policy, and providing the opportunity to highlight best practice or innovation in those areas. So I think you can see why Peter would be a very worthy recipient of that. And as I said, John will talk a bit about this. Finally, just to mention a little bit about Peter and why Peter is here and his background. Dr. Peter Rice is an addiction psychiatrist based in Scotland. He trained in Glasgow and further training in are we having
just
problems?
for the microphone, try to turn this on for you now.
Oh, yeah, I think it's on here. Yeah. He trained in Glasgow. He's been chair of the Scottish Health Action on Alcohol Problems, the SHAAP that you can see here. And this is a project of the Royal College of Physicians on the go since 2012, I think. He's one of the group of doctors that founded this organisation in 2006 to raise awareness of the challenges and extent of diversity of alcohol harms and promote, not just recognising the problem, and we can all be great at recognising problems, but to promote policy solutions integrated into healthcare management. He's chair of the Tayside Council on Alcohol, which is a local alcohol charity, and he's also a consultant to the World Health Organization in alcohol policy. He's a past chair of the Royal College of Psychiatrists in Scotland. And from 1989 to 2013, he's worked in an NHS alcohol problem service. So this really kind of the cold face, I guess, of the alcohol problem, not the nice sanitized bit that we might pick up from certain kind of media. This is the real problems that clinicians see on a daily basis on the ground. His work with the Royal College of Psychiatrists focus on the impact of mental and behavioural health to population health and health inequalities. Peter also has a lot of experience in controlled trials around interventions and examining their efficacy in improving aspects of alcohol behaviour or alcohol abuse, and also the use of online interventions. So I've waffled on enough for this evening. Our plan is to have Peter invite him up now to have a talk, and then at the end of that I'm going to pass over to John McCormack, our CEO. Peter, you're very welcome here to Ireland, and thanks again for coming and giving the talk this evening.
Right, thanks very much, Robert. Also a pleasure to come to Ireland and come to Dublin, and it's I think a particular honour to have been invited to give this talk. And what sounds like it's been a very interesting series of talks on decoding cancer. So as Robert indicated, I really come from the background as a practitioner who was working with my group of patients with, as part of a clinical team, very satisfying job. We see many people recover and get better, and often that's quite a kind of private business for people and often doesn't come to people's attention too much, but a lot of recovery goes on, and that's a great thing to see if you're a practitioner. But I think it was also clear that there was much to be done in alcohol prevention, and I became interested in that as my work carried on. So I see myself as a practitioner who really became interested in prevention. So I'm not a public health specialist by designation, and I think I've been very lucky. I think there are good grounds to say alcohol is the most interesting subject in the world. Anything you're interested in, history, culture, art, science, agriculture, almost anything you can think of, alcohol is going to have some dimension of that. So I regard myself as being very lucky to have worked in that field. And it's great, I think, to be invited to talk about alcohol and cancer, because for reasons that we'll talk about and hopefully talk about a bit more in discussion, it's been a bit of a time coming, the recognition of the relationship between alcohol and cancer, and that's an interesting phenomenon in itself, and so I'm very grateful to the Society for asking me. So I'll start with telling you things that you almost certainly already know of alcohol's contribution to a whole range of cancers, the upper digestive tract, throat cancer, laryngeal cancer, esophageal cancer, and that had been recognised for a long time. I was a boy at medical school in the early 80s. We were taught about the link between oral cancer and alcohol and smoking, so that had been known for a very long time. But I think there's been certainly growing awareness and more focus on it. And one of the questions I frequently get, that's frequently asked, and I was asked this by 2 journalists, if not 3 so far today, is why do the public not know more about this? And that is, I think, a good question. The Irish Cancer Society, I think, can take some pride in being one of the organisations that has really worked to take that message out. The first major conference that I spoke at on alcohol and cancer was here in Dublin at what I still call Lansdowne Road about 3 years ago. And there was a lot of press and publicity around about that various of us who were speaking at that event spoke at. So, you know, there's a lot of effort, but I think it is still true to say that the awareness is not as high as we would like it to be. And why is that? Well, I think it can be difficult. There's such an enormous amount of kind of health advice that comes out to people from various sources that I think it can be genuinely difficult for the public to sift through all that and sort out the wheat from the chaff. And sometimes you only really get the message through with repetition. And of course with the public realising that the advice that comes from an organisation like the Irish Cancer Society is different from the advice that maybe comes from a small theoretical study that happens to then fasten on to alcohol and cancer. So I think we need to keep working on that communication, but the society's been in the forefront of that, and that's one of the reasons I'm so pleased to have been asked to come. But let's talk a little bit about how cancer got onto the alcohol agenda. There's perhaps a different question from how did alcohol get onto the cancer agenda, but for those of us working in the alcohol field, when did cancer start to really become an important part of our world? And it was probably, maybe a little bit before 2007, but the WHO's cancer agency, IARC's report in 2007, I think really brought this to attention, although it had been probably about 20 years before that they first drew attention to the links. And it's interesting looking back that as recently as 10 years ago, if you look at the end of that statement, because the associations were noted with different types of alcohol beverage, the working group classified alcohol as being carcinogen to humans. So as recently as 9 years ago, there was still the question that, well, maybe it's not the alcohol, maybe it's other things that are in the drink. And I guess that came particularly from what was in the association between spirit drinking and oral cancer. Well, maybe it's not the alcohol itself, maybe it's something else that's in the drink. And it's interesting that, we've now moved on from that, the recognition that alcohol, the molecule, is the culprit here. And that's, I think, an important step forward. But I think there's no question that as in 2007, recognition that not just the upper GI and oropharyngeal cancers, but breast cancer and bowel cancer, there was an important relationship too. And I think that's been a big change in the overall scene, and perhaps that'd be an interesting thing for us to get into in a period of discussion about why the inclusion of breast and colorectal cancer, I think, made such a difference to the recognition in if you like, professional circles about the relationship. Maybe not yet in the public view, but it definitely has made a difference to the recognition in professional sectors. So, Scottish Health Action Alcohol Problems, which I chair and Rob mentioned earlier, we produced our first workshop report in December 2011, and that was part of a kind of range of stuff that we do as an organisation. We're probably becoming best known as a kind of campaigning organisation, particularly minimum unit price, but we do a bunch of other things too, really, to try to provide support to professionals on alcohol issues. So alcohol and cancer report is just one of them. We've completed one on alcohol and neurodevelopment. We're currently doing one on alcohol and liver disease pathways. We did one on screening brief interventions. So aside from our campaigning work, we do these kind of professional guides as well, and cancer was one of them. And we hope that that's been influential in Scotland. Just in terms of who we are as SHAAP, we are an organisation formed from the medical Royal Colleges in Scotland. So that's really why we came together. public health doctors, psychiatrists, child health doctors, physicians, and general practitioners. And the reason that we were established alongside other existing effective organisations, particularly Alcohol Focus Scotland, which is the equivalent of Alcohol Action Ireland, is that there was a feeling that there was a need for the health voice, particularly the medical voice, to get out there into this debate in a focused kind of way. Because we were facing this situation. These are liver disease mortality rates in Europe, in Scotland, and in England and Wales, from a paper that was published at the start of 2006, so this is 10 years ago. But this really got the debate going in my country, in Scotland, that the Lancet, most widely read, general medical journal in the world, ran an article that said Scotland is in a particularly bad place to do with liver disease mortality, and 80% of our liver disease deaths were due to alcohol. So this really captured public attention. This was the point at which our politicians really started to get worried, and they were asking to meet with us rather than us asking to meet with them. But I think another issue, another aspect I think that this focus on liver disease brought into relief was that the public and political concern at that time, a lot of that was about young people and public disorder. Yet here we were seeing very worrying trends on chronic health harm from long-term drinking. So what happens with liver disease really echoes and mirrors what happens with alcohol-related cancers, I'll go on to talk about later. So we really needed to kind of shift the focus onto long-term health harm, because the newspapers and various media outlets would carry stories all day about young people's drinking and public disorder. And in fact, this picture of what became known as bench girl became a bit of a kind of internet meme, really. This is a posed picture of a model that was originally taken, I think, in Bristol to illustrate a magazine article. But as you'll see from just those three things, which took me about 5 minutes to find online, this picture was being trotted out for all kinds of things. And we made a positive decision that we were not going to focus on young people and public disorder, that we were really going to focus on communicating the issues about chronic health harm. And the two main issues that we needed to talk about chronic health harm were liver disease and alcohol and cancer. So it was sometimes a bit of a difficult decision that the newspapers would phone you up and say, well, we want to do a front page on, 14-year-olds coming up to A&E. But in fact, we knew that the numbers of 14-year-olds coming to A&E were declining and had been for a pretty long time. And actually the upward trends were these chronic health harms in older people. And that was a much less comfortable message, and probably the closest I've got to being in a media storm. And I realise I've only been in Dublin a few hours, so it may be yet to come for me. But in Scotland, the biggest kickback we have from the media was when we talked about over 65s and drinking. I was described in Saga magazine as an impertinent whippersnapper for drawing attention to this. And I remember doing a radio interview with an interviewer from Birmingham who was saying, well, you're just ruining old people's fun. People worked hard all their lives, they've retired, they have the right to, sit down and have a drink and enjoy themselves. Why are you stopping them doing that? And I said, well, actually, the data I'm talking about is about older people being admitted to hospital. So this is serious stuff that's happening here. But and that was a very common discussion when you get into talking about middle-aged and older people's drinking. It's much more controversial in our media than the young people stuff. But we knew we needed to go into that uncomfortable territory. And I think the alcohol and cancer issue takes people into that uncomfortable territory. And I think that's one of the admirable things about the work that the Society's done, is that they've been willing to go in there. So having published our stuff or started our alcohol and cancer process in Scotland about 5 years ago, we're pleased that other organisations came on board. Alcohol Concern in England and the UK Alcohol and Health Alliance for published work over the subsequent couple of years. So you've seen this before about the types of cancers that alcohol can be related to, but the picture is quite a complicated one, and we don't have the same relationship for all. Different cancers have different relationships. And you'll see that the relationship between male cancers and alcohol is stronger than it is for female cancers. The relationship for oral cancer, for instance, you'll see the estimate there that over 35% of oral cancer in men is alcohol attributable. Whereas if you compare that to bowel cancer, for instance, the figure's not much more than 10%. And for women, the relationship is much lower for breast cancer. Something probably from our best evidence, and there's been some excellent Irish work on this, of course, as Robert referred to. For breast cancer, we're probably talking about something slightly over 5%. So the strength of the relationship, the importance of alcohol's contribution to cancer is different for different cancers, and that may have had an impact on the way people perceive the relationship. That oral cancer is a disease of older men who also smoke, and that may have a different place in people's perception than a relationship with breast cancer, for instance, and we might get into that in discussion. The other thing that varies is the way that the amount you drink affects your cancer risk. And there are some cancers for which your risk really starts to take off as you become a heavy drinker, and oral cancer is an example of that. So you'll see that for people who are getting into pretty substantial levels, these are UK units which are a little bit lower, a little bit smaller than your Irish standard drinks. But you'll see that people are getting up, past the kind of 10, 12 units a day. So these would be, the 88 units of alcohol a week would be people who'd be drinking maybe, over a bottle of wine a day, or, a half bottle of spirits a day, not uncommon consumption patterns in the clinical setting. So these are fairly heavy drinkers, but you'll see that for men with oral cancer, they're drinking at that level, then their relative risk compared to people who don't drink is more than 6 times. For breast cancer, it's not like that. Those heavy levels of drinking, your risk of breast cancer will slightly more than double. So the importance of this is that for some cancers, if you focus on the very heavy drinkers, you might have a big impact. So for instance, something like minimum unit price, that makes a difference really to heavy drinkers and not to moderate drinkers, despite what some people may have told you. Moderate drinkers typically don't drink very cheap alcohol because they don't drink very much, so they can afford to pay a decent price. The heavy drinkers, because they're spending a lot of money on it, go for the cheapest stuff. And that's true across all income groups. I'm happy to go into that later about the relatively wealthy people who you see in treatment clinics who will be sneaking the cheap gin and vodka into their trolleys. But minimum unit price would make a particular difference to oral cancer, to laryngeal cancer, and to esophageal cancer. But if you wanted to make a difference to breast cancer, you want measures that are going to actually affect a much wider group of the drinking population. So in other words, we need to perhaps think of doing different things for different types of cancers in terms of policy. But I think another important point to make is that an important focus here is on the overall health burden. And the point I'm trying to make here is that a small contribution to the common cancers matters. So we were talking earlier that something like about 25% of laryngeal cancer in men can be said to be related to alcohol. So this modelling we did in Scotland, this was done quite a long time ago. There's probably been better modelling done since, but it was our first stab at it. So you'll see that, with about a quarter of laryngeal cancer in men being related to alcohol, we can estimate there's about 83 alcohol attributable laryngeal cancers in Scotland each year. For breast cancer, though, although the relationship is somewhat weaker, and we're talking about 5 or 6% of cancers being alcohol related. There are many, many more breast cancers that happen. So you have a smaller percentage, but a substantially bigger number. And so we estimate that about 850 breast cancers in Scotland are alcohol related. So a relatively small contribution to common diseases or commoner diseases like bowel cancer and breast cancer matters a lot. We have big contributions to relatively rarer cancers like oral cancer, but the overall burden comes from, let's say, this contribution that's made to the commoner cancers, particularly to breast and bowel. So just really to sum it up, to sum up where we've got to, the strength and pattern of relationships between alcohol and different cancers vary. The mechanisms are of course not as well understood as we would like it to be, but we have reasonably good ideas about the factors. And acetaldehyde, which is also likely to be a considerable contribution to liver disease, is likely to be one of the male culprits in causing cancer. The problem with that is you might say, well, that's not actually alcohol, it's a breakdown product of alcohol. But I think it's extremely unlikely anybody's going to invent a different way for the body to metabolize alcohol to make it acetaldehyde free. So in other words, as sure as night follows day, if you drink alcohol, you're going to get acetaldehyde. If anybody discovers a way around that, I'll be extremely surprised and we'll all be very pleased, but I think it's unlikely to happen. And also alcohol's impact on the estrogen is thought to be one of the mechanisms for the relationship with breast cancer. But I think, and this is one of the key messages, is that alcohol's impact on cancer, as with liver disease, is really related to the alcohol molecule, not to other constituents of the drink or to the delivery system. So this is one way in which alcohol is very different from tobacco. I'm not going to open up the e-cigarettes debate, but there are safe ways to take nicotine, chewing gum patches and so on and so forth. That's not, and that can of course, maybe reduce your risk of smoking related cancer. Alcohol isn't going to be like that. I'm afraid the thing that the constituent of alcoholic drinks that cause cancer is the alcohol itself. It's the reason people drink, because they like the effect that molecule has on their brain. So the good and the bad bits of alcohol, as far as cancer goes, inevitably come together. And there's no other way to do your drinking to make it safer. I'm afraid it's related simply to the overall amount that we take in. So therefore, overall alcohol consumption trends are centrally important to cancer incidence. Okay, just the amount that people drink overall, whether it's in beer, wine, spirits, that really does not make much difference at all. It's the overall amount that's being taken on. Whether you do your drinking pub at home, whether you do it all on a Friday night or spread it through the week, none of that makes very much difference to your cancer risk. I'm afraid it's a dose-related phenomenon, and that's simply something that people are going to have to get used to thinking about. So let's move on a bit then to just talk about what we know about overall alcohol consumption. And most of the message I'll be bringing will be from Scotland. I'm very intrigued at the debates you're having in Ireland. I do know a little bit about it, but I'm not daft enough to breeze it and come and give you all the answers. But I'll talk mostly about the UK and Scotland, but I will, of course, make some reference to Ireland. This is per capita consumption in the UK across the 20th century. And the only thing you need to remember from this graph is that it changes very considerably. So we're seeing 2- or 3-fold differences in the amount that people in the UK drank overall over the 20th century, from pretty high levels of consumption at 11 litres per head. And this is the whole population. This will include, of course, some people who are abstainers, and others will be drinking their share. So we saw these high levels, consumption, big decline in the early part of the 20th century. Various reasons for that. Of course, substantial falls during the First World War, which was the first time really that permitted hours were reduced in the United Kingdom. One of the reasons that alcohol regulation really stepped up in the 1910s up to 1920s was that it was one of the conscription came in the United Kingdom, and the health of the population was looked at, and for the first time it was realised actually how poor the health of the population was, much of that alcohol related, so that was a spur to introduce many measures. And you'll see this long period of low levels of alcohol consumption, really up to the 1960s, and then a climb since. But why is this important? Well, it's important because again, back to the journalists I spoke to today, all of them spoke about the Irish drinking culture. And I'm lucky to be in an interesting position of working in various parts of the world now, and every country believes they have a unique drinking culture that doesn't change. That's just what we're like in Ireland. That's what it's always been like. We don't change. Certainly people believe that in Scotland. People believe that in Russia about themselves. Italians will say that themselves. That's just what we're like in Italy. It's in our culture. It's the soil. It's the weather. It doesn't change. And that is just not true. Things change very considerably with alcohol consumption. So there may be some kind of enduring attitudes that we have to the way that we drink, and we could have a very interesting evening talking about the difference between the Irish and the Italians. And certainly there are differences, but the way the Irish drink has changed, the way that the Scots drink has changed. And so don't get trapped into this, this is just how we are. We see big changes, and just remember that graph with these big swings from generation to generation. And we've seen the issue of who's doing the drinking change quite a bit in the UK. There's a slide from my colleague John Holmes, the University of Sheffield, and you'll see that overall with the younger groups at the bottom, their share of total alcohol consumption has been falling, and the share of the older age groups has been rising. And so 30 years ago, 2/3 of alcohol in the United Kingdom was drunk by people under the age of 45, and that's pretty much now flipped around, and more than half of alcohol is now drunk by people over 45. So we've seen declines in young people's drinking and an increase in the share of alcohol that's consumed by the older age group. So back to the message I gave you at the start, is that we need to get away from thinking about those young people over there, aren't they terrible, right? This is about, well, I'm not insulting anyone, this is about our age group, okay? And that's sometimes not a popular message, but it's really one that we have to get through. And the other analysis that John did with this was to look at women's share of drinking, and you'll see that that's increased from about 28% of all consumption in 1986 to 37%. So not a massive change, but a bit of a trek upwards. But don't forget that men drink much more than women do, and their rates of illness, including alcohol-related cancer, is higher than that of women. So sometimes I think there can be an issue in the alcohol field of people being intrigued by the new experience. I remember one meeting I was at when we moved into open session. The first question was about women's drinking. The next question was about young people's drinking. The question after that was about the drinking of immigrants and people who moved into Scotland. And somebody then said, I wish it had been me, but it wasn't. He said, lucky adult Scottish men don't drink heavily or we'd really be in trouble. And the point was, in fact, nobody expected anything different of adult Scottish men, so they almost weren't worthy of comment, their drinking habits. And that's, I think, the thing we need to bear in mind, that when we look at women's drinking, and there have been upward trends in that, we shouldn't lose sight of the fact that men still drink much more than women do. So we've seen these changes in patterns and changes in trends, and you've seen that in Ireland as well. And I stole this slide from Suzanne Costello's outfit, Alcoholics in Ireland, who's pretty much all you would want to know about consumption trends of alcohol is up on AAI's website. And that shows similar trends to what we had experienced in the UK. Probably a more rapid upward increase from the 1960s. I'd be very interested to know the change in the number of abstainers in Ireland, because traditionally Ireland had higher numbers of abstainers than the UK, particularly amongst women. You see this within the UK with Northern Ireland. Northern Ireland has much higher rates of abstainers than the rest of the UK. So that, I think, was a particularly interesting thing in Ireland. But you've similarly seen a fall in the number of heavy drinkers in the younger age group. You have a significant abstinent population, so that means when you look at per capita consumption, you need to remember that drinking is not evenly distributed across the population. You have a binge drinking pattern, of course, but the fastest growing alcohol category in your country is wine, which is not a drink we normally associate with binge drinking. So things change. So when someone talks to you about Irish drinking culture and Irish drinking behaviour is dynamic. It's changing, and it's changing, you know, before your very eyes. And just really to hammer home that point internationally, 4 European countries here, 4 members of the EU in 4 quite different patterns. Country A, which I cheated and let you know is Ireland, shows this, you know, basically rising trend from, and this is from 1960, with a bit of a bump down in the 80s, but an increase since then. Country B has shown a considerable fall in its alcohol consumption. You'll see it's mainly a wine drinking country, and its fall in consumption has been driven by a fall in its consumption of wine from the 20 litres per head of pure alcohol down to, you know, approaching a quarter of that over this period of 1961. So that country is, I know to guess which country that is. Italy. Italy. The Italian graph would look just like that, but that's France. So when people talk about Mediterranean drinking, and again, this is a bit of a mythology we have certainly in the UK, and I suspect in Ireland too, the Mediterraneans have all sorted out, you know, they can all drink like fish and they don't get much problem. That's not the case. They're really changing their drinking habits very considerably. And if you're a young Italian man, heavy drinking is something that your dad and your grandfather did, you don't do it. It's not cool, it's not fashionable. So these very big downward trends in the European countries that is easy for us to forget about. Country C shows a fairly kind of stable-ish but high level of consumption, bumping around 15 and now falling down to about 10. But really not a great deal of change in that country is Germany. And country D, which has shown a stable, low level of alcohol consumption, very low rates of alcohol harm, amongst the lowest rates of alcoholic liver disease in Europe. And I'll ask for a guess on country D is? Finland. Yeah, Sweden. So you're in the kind of Nordic territory. So, and again, there's a part of a mythology, oh well, we don't want to have our alcohol culture like they have in Scandinavia. Scandinavia has fantastically low rates of alcohol-related disease. Maybe people might see Scandinavians on holiday in the Costa del Sol along with the Irish drinking heavily. That's on their time off. Their regular alcohol consumption is very low. They have tightly regulated alcohol systems for various reasons, and that very successfully controls their levels of consumption and their levels of harm. So just remember that. Moving on fairly quickly, and I'll speed up a wee bit. We've seen some big changes in Scottish drinking. We were a pub drinking country in 1994, and we're now a home drinking country. 51% of our consumption was in pubs in 1994, and that's fallen, and it's probably down about 25%. So there's a big now. So the big shift from pub drinking to home drinking. And if you look at the heavy drinkers, if you look at people attending clinics for treatment for liver disease or addiction, they're even more weighted towards home drinking, with only about 11% of their drinking being done in pubs. And if you look at the very heaviest drinkers, so the people who typically be attending my clinic, and these will be people drinking, you know, upwards of 15 units a day, 7 pints of beer, that kind of level. They do a tiny amount of drinking in pubs, and 97% of their consumption is at home. So that's the trends we've seen. And also the important thing not to forget is that if we look at who does the drinking, it's a very concentrated phenomenon. In Scotland, 68% of all alcohol is consumed by the top 20% of drinkers. The top 10% of drinkers are drinking almost half of everything that the country drinks. And you'll see that at the other end, there are actually big numbers of people who don't drink at all or drink very lightly. So similar to your figures of 20% of abstainers, another 10% of people drinking very small amounts. Politicians sometimes don't recognise that, and so I think that's why the public support that's around for alcohol measures is often higher than politicians expect. There's a whole big bunch of the population who are not drinking much at all, and the heavy drinking is concentrated very much amongst a smallish group. And if we look in Scotland about what explains our heavy drinking, and particularly the difference between Scotland and England and Wales, we drink about 20% more than England does. And almost all of that is explained by low-cost vodka, okay, in the off-sales. So the amount of drinking that Scots do in pubs is about the same as in England. The amount of drinking of wine we do is about the same as in England. The amount of drinking of beer is about the same. And believe it or not, the amount of drinking we do of whiskey is not very different from England. It's low-cost vodka that is the big issue for Scottish drinking. We drink 40% more vodka than whiskey now in Scotland, driven by price. And that's one of the reasons we're so keen on minimum unit price, to tackle the low-cost vodkas, because it becomes such an important bit of our drinking pattern. So just to sum that up, we see